abuse. America and countries all over the world have been dealing with drug abuse for many years. Approximately 50 million Americans ages 12 and older have misused prescription drugs. Rates of new abusers jumped from 628,000 in 1990 to 2.4 million in 2001. Drug abuse tears apart families and also the health of the user. It causes relationships to be destroyed and trust to be lost. There is a new class of drug abuse on the rise, however, and it's not just in the streets or schools, it's right in your medicine cabinet. Abuse of legal pharmaceuticals is on the rise, being second only to marijuana use in the United States. Drug abuse refers to the non-medical use with specific intent to create a desired altercation in mental state or physical appearance. These statistics are not talking about the patients who are prescribed medicine and follow their doctor's orders. There are three classes of drugs that are commonly misused, which are opioids, sedatives, and stimulants. Opioids are any opiate or other agent that binds to the opioid receptors in the body, producing morphine-like effects or a state of euphoria. These are the most frequently abused of the three. These include morphine, methadone, codeine, hydrocodone, and oxycodone. Adverse clinical effects to these drugs include respiratory depression, fungal infections of the septum, declining pulmonary function, pulmonary hypertension, and death. The sedatives and tranquilizers are often known as downers. The most commonly abused are benzodiazepines, olanzapine, and ketamine. They work to suppress the central nervous system, allowing the abuser to feel almost numb to outside pain and stimuli. These drugs can cause CNS depression, slurred speech, ataxia, stupor, coma, and cardiac dysrhythmia. Stimulants are abused for different reasons than these two. They help with weight loss, academic performance, and enhance wakefulness. These drugs are similar to cocaine and have been shown to have the same side effects, such as hallucinations, altered perceptions, hypertension, seizure, anxiety, and paranoia. This kind of abuse targets populations that one would not typically associate with drug abuse. Since they are legal, people do not see them as being harmful to their health as heroin or cocaine. Men are more likely to die of a prescription drug overdose, but women are quickly closing the gap with 48,000 overdose deaths between 1999 and 2010. Women ages 25 to 54 are the most likely age group to abuse prescription drugs, with white women being the most likely to die from it. Survey data indicated that around 50% of students grades 7 to 12 did not believe that there is a great risk in abusing prescription medication, and around 30% did not believe that it is addictive. Because of this, teenagers and young adults are very likely to abuse prescription medication. Nearly 1 in 4 adolescents reported misuse of prescription medication in 2004. The rapid brain development during this developmental state implies that early exposure to prescription drugs may result in neurobiological and behavioral changes. You might wonder where they are getting these drugs. Only a small amount of doctors put themselves at risk for losing their medical license by improperly prescribing medication. In pill mills, one doctor will see many patients through a day and prescribe as many drugs as he can to them. Legitimate doctors in hospital settings can also misuse their prescription powers by not checking the history of patient or not doing proper evaluations. These pills, though, tend to spread more from person to person. 60% of users say that they had gotten medication from a family member or friend, while only 16.8% got it directly from their physician, and only 4.3% had got it from a street dealer. While street drugs continue to get a majority of the press when it comes to the war on drugs, prescription drug abuse is equally important. It has many of the same serious side effects and is dangerous because some people do not recognize it as a serious threat yet. Many people do not see the harm in borrowing pills from a friend to help study or for a test or to help a backache. Education is the key to prevention, and a well-informed population will be less likely to abuse drugs when they are aware of the consequences.